Why would we look at something that's more complicated when you could look at something that's less complicated? So there's got to be somewhere that we're going to value movement, but maybe movement that's not as complex and not as reciprocal and not as continuous and not as variable as gait. You were getting to all of the same touch points if you had done an evaluation where you just looked at patterns, changed positions, eliminate joints, change the stabilization demands, and active versus passive, so that you can bucket your solutions from a rehab and or pain management standpoint on, okay, this component is pain, that means you can almost do anything. If pain can be anything, then anything can be a part of its solution. Mobility, where joints are never going to get into the right positions to absorb adaptive stress, and that is a particular stimulus to create that adaptation. Then you have stability motor control, where sometimes they can do it in some positions or under some conditions, and other times they can't. Well, that means they can do it, they're just not doing it, and they have to learn how to do it. And then lastly, some joints are really doing everything you need them to do at this basic level. Then you move forward and use something like Gait to elicit fitness changes. Now, as you do that, you may find, if you have Gait as this enormous value point, maybe the complexity of Gait then leads to the next step of mobility or motor control limitations. But I don't think it should be the first.